Tooth plaque and stubborn dental stains after the age of 60 are not just a cosmetic concern. They are often the first visible sign of a deeper and more dangerous process happening inside the mouth and even throughout the body. What starts as mild yellowing or rough buildup on the teeth can quietly progress into gum inflammation, chronic bad breath, gum recession, tooth loosening, and in advanced cases, tooth loss. But what most seniors don't realize is that this is not simply a cleaning issue. It is a biological imbalance that becomes more aggressive with age. After 60, saliva production naturally declines, enamel becomes thinner, and the mouth loses some of its natural defense against bacteria. This is why nearly 68% of adults over 65 show signs of gum disease according to clinical dental research, and many of them don't even feel pain until the damage is already advanced. Even more concerning, studies from geriatric dental specialists show that untreated oral bacteria can contribute to inflammation in the bloodstream, increasing risks linked to heart health and overall vitality. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. In this video, I will reveal what is really behind plaque buildup and tooth staining after 60, and why standard brushing advice often fails to stop it from returning. The real danger here is not just losing a bright smile. It is losing confidence, comfortable eating, and eventually independence when dental health declines. Many seniors try whitening products or harsh chemical rinses, yet the problem keeps coming back because the root cause is still active beneath the surface. Today, I will walk you through a carefully ranked list of the most effective natural and science-supported approaches, and I will also expose one common mistake almost every senior unknowingly makes that actually speeds up plaque formation instead of stopping it. In order to understand why dental plaque and staining become so persistent after the age of 60, we need to look beneath the surface of the teeth and focus on what is happening biologically inside the mouth. Plaque is not simply dirt. It is a living biofilm made up of bacteria, saliva proteins, and food particles that naturally form on teeth throughout the day. In younger adults, saliva flow and enamel strength help control this buildup. But after 60, several changes begin to shift the balance in favor of bacteria. One of the most important changes is the reduction in saliva production, a condition often referred to as dry mouth or xerostomia. Saliva is the mouth's natural cleaning system. It neutralizes acids, washes away food debris, and limits bacterial growth. Clinical studies show that saliva flow can decrease significantly with age, and even more so in individuals taking common medications such as blood pressure drugs, antihistamines, or antidepressants. When this protective layer weakens, plaque forms faster and sticks more firmly to tooth surfaces. Another key factor is enamel thinning. Over time, the outer protective layer of teeth naturally wears down. Research published in geriatric dental journals shows that enamel becomes more porous with age, allowing stains from coffee, tea, tobacco, and even certain foods to penetrate deeper and become harder to remove. At the same time, gum recession exposes the softer root surfaces of teeth, which are far more vulnerable to bacterial accumulation and discoloration. Clinical studies also highlight that adults over 60 are significantly more prone to chronic low-grade gum inflammation, even when they maintain regular brushing habits. In fact, researchers estimate that nearly 70% of seniors show some degree of periodontal inflammation, which creates an environment where plaque not only forms faster, but also becomes more resistant to normal cleaning routines. This is why standard advice like brush twice a day or use whitening toothpaste often fails at this stage of life. It does not address the deeper biological shifts happening in saliva production, enamel integrity, and gum health. As a result, plaque continues to return even in people who are careful with oral hygiene. Even though dental plaque and staining after 60 feel frustrating and sometimes inevitable, many seniors unknowingly make small daily choices that actually accelerate the problem instead of controlling it. The most common mistake is relying too heavily on whitening toothpaste and abrasive scrubbing. While these products may create a temporary clean feeling, many whitening formulas contain mild abrasives that can slowly wear down already thinning enamel. Over time, this makes teeth more porous, allowing stains and bacteria to attach even more easily. The result is a cycle where teeth appear temporarily brighter but actually become more vulnerable underneath. Another widespread misconception is thinking that brushing harder equals better cleaning. In reality, excessive pressure can damage the gum line, especially when gums have already begun to recede with age. This can expose the root surfaces of teeth, which are softer and more sensitive to staining and bacterial buildup. Clinical dental observations consistently show that aggressive brushing contributes more to gum recession than it prevents plaque. A third mistake is ignoring dry mouth, especially in seniors who take multiple medications. Many people simply drink water occasionally and assume it is enough, but chronic dryness is not corrected by hydration alone. Without sufficient saliva flow, bacteria remain longer on tooth surfaces, feeding plaque formation and increasing discoloration. The key issue with all these habits is that they focus only on the surface of the teeth, not the biological environment that controls plaque formation. Standard dental advice often treats symptoms, removing visible buildup, but does not correct the internal conditions that allow plaque to return so quickly. However, modern dental research increasingly suggests that this decline is not purely irreversible. By changing the oral environment, especially saliva support, bacterial balance, and enamel protection, it is possible to significantly reduce plaque buildup even later in life. Now let's move into the ranked solutions, from the least effective supportive habits to the most impactful science-backed approaches for reducing plaque buildup and dental staining after 60. These are not miracle fixes, but they can meaningfully improve oral conditions when practiced consistently. Starting at number 10, increased plain water intake throughout the day helps slightly by rinsing away loose food particles and reducing dry mouth. It supports saliva-like function, but its effect is limited because it does not actively disrupt bacterial biofilm. On its own, it may only reduce surface debris by about 5 to 10%, and it cannot remove hardened plaque. Verdict: helpful support, but not a treatment. At number 9, sugar reduction plays a major role in slowing bacterial growth. Oral bacteria feed on sugar and produce acids that accelerate enamel damage and staining. Cutting excess sugar can reduce acid production by up to 15 to 20%, but it does not reverse existing plaque. Limitation: benefits take time and depend on overall diet consistency. Verdict: important for prevention, not reversal. Number 8 is oil pulling, typically using coconut oil. It may help reduce some surface bacteria due to its mild antimicrobial properties. Small studies suggest up to a 20% reduction in certain oral bacteria after consistent use. However, it does not penetrate hardened plaque layers. Verdict: optional complementary habit with modest benefit. At number 7, using electric toothbrushes improves mechanical plaque removal efficiency compared to manual brushing. Clinical comparisons show around 25 to 30% better plaque reduction when used correctly. However, technique still matters, and it does not address gum inflammation or saliva issues. Verdict: effective upgrade, but not a complete solution. Number 6 is increasing fiber-rich raw foods like apples, carrots, and celery. These foods stimulate natural cleaning through chewing and increase saliva flow. This can reduce surface buildup by approximately 20–25%, but results are indirect and limited. Verdict: good natural support for daily maintenance. At number 5, antibacterial mouth rinses with mild ingredients like chlorhexidine, used short-term under guidance, or natural alternatives can reduce bacterial load significantly, up to 30–40% in some clinical settings. However, long-term use may disrupt healthy oral microbiota or cause temporary staining. Verdict: effective, but should be used carefully and not continuously. Number 4 is improving oral hygiene timing, especially brushing after the last meal and before sleep. Overnight is when bacteria multiply most aggressively due to reduced saliva flow. This adjustment alone can reduce overnight plaque formation by up to 35%. Limitation: requires discipline and consistency. Verdict: highly impactful daily habit. At number 3, addressing dry mouth through saliva. Supporting habits like chewing sugar-free gum or using xylitol products can significantly reduce bacterial adhesion. Studies show up to 40% improvement in plaque control when saliva flow is actively stimulated. However, it is temporary and needs repetition throughout the day. Verdict: very strong support strategy. Number 2 is professional dental scaling and cleaning every 6 months. This physically removes hardened tartar that home care cannot eliminate. It can reset oral health conditions by 60–80%, depending on severity. Limitation: does not prevent recurrence without lifestyle support. Verdict: essential maintenance step. Finally, number 1 is long-term oral microbiome balance through consistent use of fluoride-based care combined with gentle, non-abrasive cleaning and saliva protection strategies. This approach addresses the root biological environment, enamel strength, bacterial balance, and moisture levels. When practiced consistently, it can reduce plaque recurrence by up to 70% over time. Limitation: results are gradual and require discipline. Verdict: the most effective long-term foundation for oral health after 60. Now that we've ranked the full spectrum of approaches, let's focus on the top 3 solutions that actually make the biggest difference in reducing plaque buildup and stubborn dental stains after 60, and how to apply them in a realistic, daily routine. The first and third most important solutions work together: saliva support and microbiome balance. After 60, the mouth loses much of its natural cleansing ability, so restoring that balance becomes the foundation of everything else. Sugar-free chewing gum with xylitol after meals is one of the simplest and most effective ways to stimulate saliva flow. Chewing for 10–15 minutes after eating helps wash away food particles, neutralize acids, and reduce bacterial adhesion. Studies suggest this alone can reduce plaque formation by up to 40% when used consistently. The key is timing, right after meals, not hours later. A mild caution is that overuse may cause jaw fatigue in some individuals, especially those with temporomandibular joint sensitivity, but this is generally harmless. The second top solution is professional dental scaling combined with consistent home maintenance. While home care can slow plaque buildup, hardened tartar cannot be removed without professional tools. A dental cleaning every 6 months effectively resets the oral environment by removing deep bacterial deposits that fuel ongoing inflammation. This can improve gum health and reduce visible staining significantly within weeks. However, it is important to understand that this is not a permanent fix. It must be paired with daily habits to prevent rapid reaccumulation. Now, the number 1 most powerful approach is protecting enamel integrity while avoiding abrasion. This means switching to a soft bristled toothbrush, using gentle fluoride-based toothpaste, and avoiding harsh whitening abrasives that gradually weaken the tooth surface. Fluoride strengthens enamel by promoting remineralization, making it more resistant to acid attacks and staining. When combined with proper technique, light pressure, circular motion, and twice daily brushing, it creates a stable protective barrier. Over time, this can reduce plaque retention and staining recurrence by up to 60–70%. One realistic caution here is that some individuals may experience mild tooth sensitivity when switching to fluoride-based care if enamel is already weakened. This usually improves within a few days as the teeth adapt. Together, these 3 strategies, stimulating saliva, maintaining professional cleaning, and strengthening enamel protection, form a complete system that addresses both the cause and the surface effects of plaque and staining after 60, rather than just masking symptoms. Many seniors unknowingly continue habits that quietly keep plaque and staining returning, even when they are trying their best to care for their teeth. The first major mistake is using harsh whitening products daily, which slowly weakens enamel instead of protecting it. The second is brushing too aggressively, thinking it will remove more plaque, when in reality it can damage gums and expose sensitive root surfaces. The third mistake is ignoring dry mouth and medication effects, which allows bacteria to multiply faster throughout the day and night. The fourth is inconsistent oral care timing, especially skipping nighttime cleaning when bacterial activity is at its peak. The important shift in understanding here is that dental decline after 60 is not simply aging that must be accepted. It is more accurately a biological imbalance between saliva, bacteria, and enamel protection. When that balance is restored through consistent daily habits, the mouth can regain stability and cleanliness over time. For the next 30 days, the focus should not be perfection, but consistency, supporting saliva flow after meals, maintaining gentle enamel-friendly brushing, and ensuring regular professional cleaning if needed. Within this period, many people notice a gradual reduction in plaque buildup, fresher breath, and a cleaner tooth surface. The goal is not instant transformation, but rebuilding control over oral health and maintaining independence, comfort, and confidence in daily life.